I walked into the pediatrician's office excited, thinking maybe this was the day that everything would change for me. The problems I'd been having my entire life that had led to the point where I could only eat 9 foods because I had so many allergies, and the pattern that I had started seeing that connected all these seemingly random health issues would finally lead to something, a new test, a new doctor, really an answer. So I walk into the small, dark patient room, and this day I was put into the green room, and I thought, green's my favorite color, this has to be a sign. When the doctor walks in, I'm practically jumping out of my seat with excitement. I'd been waiting for this day where I could finally tell her this pattern that I had seen and that there would be an answer. So I tell her that I'd found a pattern that connected all these seemingly random issues, and all she says to me is, Jenna, don't kid yourself. You'll never find an answer that explains everything. So I left, feeling extremely disappointed. I felt so much worse, even though nothing had actually changed with my health, but that experience that I'd had made me feel 10 times worse. I've faced many challenges, but I've also worked in the healthcare for over 5 years, and I've not only experienced those issues in the healthcare system, but I've witnessed the potential for change and innovation. In a system that often fails to recognize and connect patient experiences, we have to ask the question, is there room for creativity in healthcare? And I'm going to show you why there is not only room for it, but a desperate need for creativity in our fragmented healthcare system. First, there are a lot of big words when we're talking healthcare and innovation. So first, I'm going to define what I mean by creativity. When I'm talking creativity in healthcare, this means stepping outside of the box and outside of the constraints of the system to find innovative solutions. And yes, constraints are there for a reason. They're important. But if we don't step outside of those constraints to come up with big ideas and then fit those ideas and solutions to the constraints, we'll never discover what could be. Now, today when I'm talking about healthcare, I'm talking about 2 words: health, space, care. The delivery of care, the delivery of medicine, the experience of being cared for with medicine. And we need to think about the human experience and then craft care around that. Now, creativity also became my personal tool for survival within this fragmented healthcare system. It allowed me to explore alternative care options and find different ways to advocate for myself. It also allowed me to come up with creative ways of communicating, of presenting and articulating my information, and truly just making sense of my experiences. Now, although I still struggle with my health every single day, I can stand here and say I have an extremely validating diagnosis. One that you could argue I only got because of one thing I said to one doctor, and that I would have never said that thing if it wasn't for the creativity of his care. So let me tell you about it. I went to a new doctor this time, a specialist, and I could just tell that the experience was different from the beginning. For starters, I came prepared in a different way. I had found creative ways to track my symptoms, medications, and present that because I knew that if I could make more sense of my experiences, it would make more sense to somebody else that I would tell it to. So I went into his office, this bright room, the LA skyline out the window. I think I could even see the Hollywood sign. And starting with even the intake form, he asked me questions like what I thought was going on. And it was clear that he cared about what I was thinking. And it got to the point where he started listing what tests he wanted to order. And afterwards, he asked me if there were any tests I thought were missing. He truly wanted to validate each and every thought I had so that I didn't leave thinking, what if? And as I was about to leave and I was walking out the door, I thought of something that had happened. Something that I'd told my pediatrician about and she'd dismissed, saying it was completely normal. And something in me was just telling me to tell this new doctor. So I turned around to him and I said, something happened the other day and it's random. And immediately, he asked me to come sit back down with him. He didn't want it to be a passing thought as I walked out the door. So I sat back down with him, we continued our conversation. And as soon as I had told him what happened, I saw a light bulb go off in his head. He said, yes, what happened can be normal, but it can also be a sign of a condition that happens to also explain quite a few of the other things you've mentioned today. So he told me he wanted to order one more test. And to make a long story short, that one test came back positive. It rarely does, even for people who know they have the condition. And that started me on the still very lengthy journey to getting a diagnosis for a condition, mast cell activation syndrome. One condition that explained every little thing that had happened since I was a baby. Just like I had thought that day when I went to see the pediatrician. For 18 years, the things that no one could figure out, that puzzled every person, every provider I saw, I had started to figure out. but I'd almost never said it again because I'd been shut down. Bringing creativity into the way we deliver healthcare allows us to find new ways to connect with patients, to understand their experiences, and tailor the way we communicate with them, because in the end, it's a team effort. Creativity and design shape the entire healthcare experience. Imagine it like a box in which healthcare is delivered. The experience is what creates the connection between patients and providers, and truly anybody and any stakeholder in the system. And that experience is what drives engagement and satisfaction, things that we talk about wanting to improve in healthcare. So let me help you imagine what healthcare could look like with more creativity. Seems like everyone right now is talking about AI. And I've heard a couple people say, well, what if AI is going to replace my doctor or nurse? And we all know that's not going to happen. But where AI truly has value in healthcare is in managing the vast amounts of data and information so that providers can spend more time communicating with and building relationships with their patients. For example, AI can analyze a complex data set in 40 seconds that might take a human 20 minutes. It can also support in decision-making by analyzing and aggregating patient information. Most people I've talked to describe healthcare as a sterile hospital experience, as an unwelcoming, uninviting environment, and like it's only sick care. But why can't we reimagine the experience of healthcare? Why can't waiting rooms be a relaxing and inviting environment? Why can't patients feel confident and intelligent when talking to their providers? And why can't booking a service in healthcare be as easy and quick as booking a hotel? Look at One Medical, for example. They've completely flipped the typical clinic environment. Their waiting rooms resemble hotel lobbies, a calm, relaxing, inviting place to sit and wait. And they've used technology to streamline everything on their app. Everything from booking an appointment with your primary care provider, to seeing test results, to even getting virtual care 24/7. Why wait on the phone to get an appointment with a doctor only for it to be 6 weeks away? A very common experience for patients. And why have clinics spend hours and hours managing these phone calls? Well, companies like ZocDoc and Sesame are sort of like the open table for healthcare. They allow patients or consumer, as healthcare is becoming much more consumer driven, the ability to choose and prioritize what they value when booking a service, such as cost, the next available, seeing the same provider they've seen before, location, or even reviews. And looking at how hospitals creatively innovate the experience, we can see from wayfinding, the concept of using themes or colors to help somebody understand where they are in a space. Cedars-Sinai, for example, integrated their wayfinding into their app, sort of like Google Maps, but for within the hospital, which is extremely useful because oftentimes, especially in a stressful environment, hospitals can be very difficult to navigate. And it's not just software. Hospitals are starting to recognize the insights from research that show how things like environment can influence patient recovery and patient outcomes, as well as the way that a clinical team functions. In 1984, Robert Ulrich published a study comparing surgical recovery in patients with rooms with a view of nature versus a view of a brick wall. He found that patients in a room with a view of nature had overall negative complaints to their nurses, took fewer pain medications, and even had an overall shorter post-operative recovery stay. I've even seen systems in hospitals that allow patients to control things like window shades, temperature, or even lighting. Even hospitals that have Amazon Alexa type of technology, which is oftentimes the technology people have at home that can help the hospital stay feel more comfortable and like being at home. And yes, healthcare as an industry is different. It has its unique nuances. So yes, we do have to design for those uniqueness of the healthcare industry, but we can also take approaches from successful systems in other industries and apply that to healthcare. In the 1930s, Boeing developed a checklist for a list of tasks for pilots to do pre-flight, which dramatically reduced crashes. Inspired by this, the surgical safety checklist was developed to increase communication between surgical teams. The World Health Organization says that the safe surgery checklist reduces complications and mortality by over 30%. And you may be asking, well, Jenna, a lot of this costs so much money. And yes, it can cost a lot of money, but Using creativity in healthcare and designing better experiences doesn't have to be expensive or fancy. Oftentimes we don't have the resources to implement a new technology or completely redesign a hospital. Creatively improving an experience could be as simple as setting a new standard for a cleaner appearing environment, having more seating options, fake plants, or even smiles, as smiles have been shown to influence patient outcomes. It could even be as simple as respect and working as an interconnected team, because it's about taking ownership and recognizing that it's not just you. Because when you act like it is, it only reinforces the fragmented system. And it's not just about the objective outcome. We need to consider the patient's expectations, and we need to use the human experience to shape how we deliver healthcare, because in the end, what the patient remembers is the experience. It's clear that there isn't just room for creativity in healthcare, but there's a need for it. Creativity is what allows us not to just deliver medicine, but to deliver healthcare. From being shut down and disappointed in that small, dark, green room with the pediatrician, to being listened to, cared for, and empowered in that bright, inviting room with the second doctor, my journey shows us that healthcare isn't just measured by the end outcomes, but it's about how these outcomes are achieved and how we make patients feel along the way. Together, we can create experiences that engage and empower patients so that we not only provide successful care, but care that they feel good about. Because creativity is the bridge between medicine and healthcare.